Hi there, my name is Rebecca Williamson. I'm publisher of Fierce Biotech, and I'm here today with Pete Flath, Director of Sales and Marketing at Wilco, Harsha Katkam, VP of Healthcare and Life Sciences at Wilco, Joe Paxton, SVP and Market Business Leader of Life Sciences at Citiustech. Gentlemen, thank you for joining me today.
Thank you.
So, Joe, let's start with you. So first off, congratulations on the 2024 AWS Partner of the Year Award for the HLS industry. That's an amazing accomplishment.
Yeah, thank you.
So tell me, why does Citiustech focus on HLS, and what do you think stood out to AWS when selecting you for this award?
Yeah, thank you so much for the question. And I'll start with why Citiustech focuses on HLS. And really, it was the vision of the founders of the company. They saw that there was a true opportunity to really build domain knowledge in this industry, and it's required to service the industry, but they also saw the opportunity to tie that to the technology innovation and come out with innovative and compelling solutions for the market. So that's what the business is built on, and that continues to be our focus today. And their ambition was to be the #1 healthcare and life sciences technology services company in the world. And that continues to be our vision today. And then your other question about, and I really am excited to talk about this question, about why we were selected AWS Partner of the Year for healthcare and life sciences. And we talked to AWS, we asked that question, and they said, well, let me give you a little background. There are 300,000 business partners for AWS. 1,250 of those partners nominated for this award. And Citiustech was chosen, one, because of your market presence. You're in about 50% of the Fortune 500 healthcare and life sciences companies. Two, you've built solutions on the AWS marketplace. We have over 24 solutions for healthcare and life sciences on their marketplace. And then third is because we built our competencies. We have 5 competencies: healthcare, life sciences, data migration, and DevOps. And for that reason, we were selected for the award.
So Joe, when you think about healthcare and life sciences, what kind of challenges do you see clients tackling most often in 2024 and 2025? And how do you position yourselves to address these effectively?
Yeah, thank you for this question. And it's, I think that, every year there's a challenge. And this year it begins and starts with time to market. You talk to most of our clients, they're looking at how they improve efficiency, how they reduce costs, and ultimately how they engage their patients better. And they're really focused on how do we take advantage of technology in order to accomplish that. And then really, how do we work with a partner that has the domain knowledge to really provide value to those solutions. And so how we position ourselves, one, we're going to be up to date on the latest technology. So Gen AI and everything that's evolving in this space, we are prepared and capable of leading those conversations and talking through those challenges and applying that technology to those opportunities. So that's what we see in 24-25 is a real focus on this innovation that's occurring and applying it to their requirements.
So Pete, I'll move over to you. So first, congrats on Wilco's 10-year milestone.
Thank you. Very exciting times.
So now being exclusively focused on HLS and working only with Salesforce must come with its challenges. Has this focus approach been a strength for you? And does it help your prospects or clients in any way? And has it been difficult to turn down opportunities outside of Salesforce?
Yeah, so from a strength standpoint, our company wakes up every morning and we think about our HLS customers and we think, how are we going to improve their Salesforce, right? So when you think of 10 years ago when we started, Salesforce was very established. It was primarily CRM, a lot of sales and service, and there were some other technologies that came along. Really recently what we've seen is many companies are now using the industry-specific products within Salesforce. And so there's a lot of transformation that's occurring with those product sets. So you've got Health Cloud, you've got Life Sciences Cloud now, which we're actually a preferred implementation partner of that product. We have certifications in all the different new technologies that they've got. And when we work with our customers, our focus is, it's not, where can we go find other business? There's a lot of partners in the ecosystem that'll do all verticals. That's a distraction. it's really hard to have that domain knowledge and expertise and really partner tightly with those companies. And I'm talking big companies, like in the enterprise space, we work with top 5 pharma, we work with very big providers within the marketplace, and they need our attention and time. And so one of the things that we do with those partners is understanding their business. We work through all the edge case issues that they have. So there's really no swivel chair when they get complete with that implementation. And they have a full on-platform implementation of Salesforce. And then within a couple 6 months or a year, they're going to have to make modifications because the business transforms again. So it's not a set it and forget it. You don't pave the cow path. You're always making changes and you're always making improvements and enhancements. And we're right there with those customers. So for me to opportunistically go and work with media companies or finance companies, I'd really be doing my customers a disservice.
Now, Salesforce has made some significant announcements recently for the HLS industry, particularly around AI and ML. Tell me, what's been the general response from customers? What advice would you give HLS organizations as they consider their 2025 priorities and evaluate Salesforce?
Yeah, so when some of this stuff was launched by Salesforce at Dreamforce, and then there's been a bunch of world tour events that they've done sequentially to that. First of all, the life sciences cloud is a huge hit. There's competing products in the marketplace, but when you're able to build out a life science product on a platform that you can then leverage to use it for other capabilities and business value and first time to value, it's massive. And then when you pair that with all the data cloud stuff that they're doing, look, everyone's got data, structured, unstructured data, it's sitting all over the place. To be able to take the data that they have within their systems, pull it into the platform, the Salesforce platform, and then leverage it through Life Sciences Cloud, it's a total game changer for the industry. You take that piece of it and you take agentic AI through Agentforce and all the other capabilities that they have with that. Now you're giving an agent who's engaging with a member, a patient, a physician, anyone within the market. And if you think about it a little bit further, like agent doesn't necessarily mean someone that's patient-facing, customer-facing. An agent is anyone in an organization that needs important data and the right data at the right time presented to them in a fashion so they can accurately, so no hallucinations, right? Accurately be able to engage with whomever they're engaging with in a very crisp, precise manner and have amazing follow-up for that. So one of the things we always tell our clients is, look, if you need to take the crawl, walk, run approach, do it. Don't make a ton of mistakes. Don't do the Big Bang Theory when it comes to Salesforce. You can ideate, you can iterate, and you can innovate on the platform. And it really is a game changer for a lot of organizations. And there's always something new that's coming up, right? There's so many different initiatives, so many different mandates customers have so they can continue to provide shareholder value in the end of the day.
So Harsha, I'll move over to you. Tell me, how have your recent projects been impacted by the new platform rollouts, and are there initiatives from Salesforce or Wilco Source that you believe could make a big difference for your clients or for the broader HLS industry?
Thanks for the question. So the new platform rollouts significantly brought a positive impact to our customers in all the angles, whether it's a data management, or bringing a process efficiencies, or a user efficiencies. So it changed the game on how we can leverage the configuration over the customization for our customer. To give a couple of examples, for one of the medtech company, we did launch a full-fledged platform just within 8 weeks. That's remarkable, and nobody did in the industry. Were able to accomplish that with the latest rollout. And for another customer, we did launch like 10 plus programs within a year. That's amount of work with leveraging the latest rollouts is only possible with the Salesforce. Coming to your second part of your questions, what are the initiatives where we'll be focusing on this year? AI is one of the key critical aspects. AI is not a buzzword. Everybody uses AI. We all use it now in our day-to-day, but life sciences industry is a little bit behind. Lot of day-to-day tasks, whether it's a data entry or a business process or an outreach, they are still done by manual human agents, and it's always tend to have a typos and errors, or it tend to take a time. What we are working with Salesforce with their latest products on Life Sciences Cloud, Data Cloud, and Agentforce especially, we're trying to bring certain AI use cases, solving these use cases through AI with the automation into the picture, automated emails, and trying to bring a change into the life sciences industry is what our focus is, and that's what we are looking forward to our clients this year.
Well, thank you so much for joining me today. I really appreciate the conversation.
Thanks,
you,
Rebecca.
Thank you.